on this episode of A Tale of Two Hygienists.
There's such a disconnect between the medical side, the dental side, and how we embed that in that middle person to get that person to be like, oh, this is so important. Let's take out all the clinical aspects. Let's bring it back to the preventative. Let's start from the beginning. The minute they're getting admitted to the hospital, let's try to figure out how we can keep that mouth in that symbiotic state so we can decrease infection. I worked so hard on my resume, and even my resume they said wasn't even the greatest, right? But I worked so hard and doing so much work for free. Went out to public health departments, said, hey, how can I help support you? What, do you have an oral health division? Do you have any areas for like special needs patients that you need me to educate caregivers? Start doing that work on your own time for free. Add that to your resume. That is going to put you at the best benefit of getting a job outside of the clinical operatory.
Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of two hygienists.
Welcome back, everyone, to another episode of A Tale of Two Hygienists podcast, and happy Wednesday to you all. You are listening to episode number 436. I'm your host, Andrew Johnston. Thank you so much for taking the time to spend with us today, and you're not going to regret that. In this episode, we welcome in Katharine Martinez to the show. Katharine has carved out a kind of a really cool opportunity leveraging her background as a dental hygienist, but into a position in a hospital setting. Katharine's mission is, I would say, probably twofold. I hope this is not putting words into her mouth, but one, it feels like she really wants to share this opportunity with other dental hygienists, just as many people as possible, really. And then two, it's because there's such a high need. The patients really need help. They need advocates in the hospital setting, and we're the perfect people to fill that position. So it kind of felt like that's kind of how the episode went. She was kind of sharing her experiences, but also really showing us how we can be an advocate for these patients. This is another episode where I think that you all need to really reach out to our guest. And so her contact information, of course, is in the show notes, but reach out to her, let her help you if you're interested in this. I think this is going to be probably a next wave of things that dental hygienists end up doing in the coming years. And then next week, we have another amazing show. We welcome back Joanne Gorenley into the show. She's been on a few times before. Truly one of my favorite people in dentistry because she has a very strategic mind. She's a strategic thinker. She sees big pictures, often things that maybe the rest of us aren't seeing. And she really wants what's best for us as individuals. And so I feel like she's one of those people that has been out there fighting the fight so that we on the clinical level, going in and out of the office every day, are really supported and helped. And if that weren't enough, she's probably one of the most humble people for as many things as she has accomplished. Like, she just is incredibly humble about that. And it's just fun to talk to her. We had a game plan for that episode, but as always happens, she says something very interesting or very just thought-provoking, and I sidetracked us multiple times. So we cover a lot of things in that episode. So it's, again, kind of hard to say this is the subject that we covered, but we covered a lot of really great subjects. So be sure to come back. Don't miss that one. And that'll be next week. Okay, so that's it for us. Thanks again to our co-host, Annie, and our guest, Katharine. You all are going to love this one.
A tale of two hygienists.
All right, listeners, welcome into the interview portion of the podcast. We are joined today by Katharine Martinez. Katharine, welcome to the show.
Thank you both so much for having me. I'm so excited.
Oh my gosh. So listeners, this is kind of what happened. This is why we have Katharine on. This is going to be an episode. We've done, almost 1,000 episodes now. We've never done one like this, I'll tell you that. And then, so kind of what happened, and Katharine, correct me if I'm wrong, or kind of fill in the blanks, is, we're both part of a Facebook group called Trapped in the Op, and you had posted on there about what your role is. And it's one of the most unique roles I think I've ever heard for a hygienist having. So do you mind explaining a little bit about like what your role is?
Yeah, for sure. So my job title is an oral health educator, and I work at Phoenix Children's Hospital, and I'm a dental hygienist. That is my background by nature. That's kind of what I do. That's kind of how I present myself in the hospital. I do also have my master's of public health degree. I would not say you need that master's of public health degree to do what I'm doing, but it has opened up the door to help me develop a program that has really gathered a lot of speed and is really the reason why this role is still existing 5 years to the date right now.
So, Katharine, how did you get started in this? What drove you to want to start this at Phoenix Children's?
So it actually wasn't my doing to get started with it. So it was actually a long backstory with Delta Dental of Arizona. They have a foundation within their, insurance company that philanthropy funds a lot of different things out in the community that really helps to expand oral health access for all Arizonans. So they had this money and they came to know somebody in the foundation at Phoenix Children's Hospital. So when you think about foundations, they're very different than the actual organization. So when you talk about Phoenix Children's Foundation, it's not going to be the hospital that we're talking about. We're talking about that foundation that funds all the philanthropy. So somebody from Delta Dental Arizona's foundation came to Phoenix Children's Foundation and said, hey, we have some money and we would like to figure out a way to expand oral health into your hospital. And the foundation's like, you know what? We're willing to take your money, right? We're going to take your money. We just don't know how. We've never had anything like this. There's really nothing to go off of. But let me touch base with the chief nursing officer at the hospital and see if there's something that we can do. And so they did. So they all kind of commingled. And the chief nursing officer, who was Julie Bowman at the time, she was like, this is very interesting. I don't know how we can kind of work this in. So it was about 2-year process of them talking with the foundation at Phoenix Children's and then talking to the foundation at Delta Dental of Arizona and our chief nursing officer for like 2 years, figuring out how do we even make something like this? Do we want a dentist? Do we want just the Delta Dental to fund oral care packets? What do we want and what do we envision? And it really was this kind of collaborative approach where we have been with the Solutions for Patient Safety, which is a large organization of, I want to say, over 150 children's hospitals that all combine together to do no harm for a patient. So they are willing to share kind of inside information, whether or not what's working, what's not working. And as a collaborative group, they came up with this oral care kind of bundle for hematology oncology patients to reducing infections. And our hospital had started to implement that back in 2017, 2018, and they started to see a decrease in infections. And so our CNO, our chief nursing officer, was like, you know what? I think we could bring somebody in to help educate and do preventative care, utilizing what we had already implemented and just carrying it out. Where a lot of other children's hospitals started to do it, and they didn't see a great decrease in infections, so they just kind of dropped it off their radar. Where our hospital did see an increase and said, you know what, I think we can continue with this momentum going forward. Let's bring in an oral health specialist who could then educate and help to carry out that bundle. So that's kind of how my position came to be. And how I got to it was, it just so happened at the time that I was looking on it Indeed, right? And there was this random oral health educator for Phoenix Children's Hospital. And I was like, wow, this kind of seems interesting. And, it was very vague. The job description was very vague. They weren't even asking for like a master's of public health. They were asking for actually like a master's in dental hygiene. They were like, we want somebody who has somewhat pediatric experience, but it was really vague. And I was like, I'm just going to apply. I don't even know if I even fit the criteria for this role. And so when I went in to get interviewed and everything, they were like, we honestly don't have any questions for you because we don't even know what to ask. We don't even know what this position's going to be. So we're going to open it up to you to ask us those questions. So I think they said they interviewed about, I wanted to say like 15 people, and like 6 of them were actual dentists who were looking to get out of clinical dentistry and coming into the hospital. And so it was 6 dentists. I want to say there was 2 PhD hygienists, 4 master's prepared hygienists, and then there was me with public health, and I think there was a couple other people, but they picked the top 3. And the top 3 was going to create full-on presentation for all the upper leadership of the hospital and all of Delta Dental of Arizona's foundation. So they recorded you doing your presentation. So you had to create like a 15, 20-minute presentation, present it to all that upper leadership. Then it went over to Delta Dental. And so they called me up after, 2 weeks of doing that presentation. They were like, we just want to let you know it was a unanimous decision among everybody in that boardroom and among everybody at Delta Dental of Arizona that it was going to be you. And they're like, we want to let you know you were not the best on paper. Your resume was not the best on paper. And I was like, well, that's really kind of hurts my feelings.
I didn't need to know that.
Right. They're like, but your presentation was exactly what we could envision for what this position was going to be going forward. And they're like, and you were going up against 2 other dentists. So I was like, oh, so that makes, obviously whatever I did in that presentation just kind of blew them all away. And so I really think it went back to, what we learned in hygiene school and education and how we really can take what we learn and what we know and how we incorporate that, and we can make it however we want. And if you have that passion and you have that drive, it comes through. So they saw something in me, and it was only going to be a 2-year grant funded position. And so after 2 years, Delta Dental was like, oh my gosh, we love what you're doing. We want to fund you again for a whole nother year. So 100% was funded again by Delta Dental, and then they reevaluated it. And they were like, we still love what you're doing. They're like, but we want to start to see it become a position with embedded in the hospital. So they were decreasing down to 50%. And our hospital said, you know what? We see what Katharine's doing. They put out a poll throughout the entire organization at Phoenix Children's, and it came back, you have to keep Katharine on. We love Katharine. We see what she's doing. We see what she's, the difference she's making. And so the hospital was like, okay, you know what? We're going to make her part of our, department education fund and our budget, which I'm not philanthropy funded by the hospital now. I'm actually funded in the hospital. So that's kind of how that role is going. So it's a for sure position now going forward. And at the beginning, they were, the chief nursing officer was like, it's only like a 2-year grant fund position. Are you okay with that? And I said, yeah, I'm okay with that. Because once that 2 years is up, I'm going to show you that you guys are not going to let me go. And it kind of proved true. So it's like, okay, have that confidence in yourself and know what you're going to bring to the table and open everyone's eyes.
I don't think anyone's ever had that difficult of a journey just to try to get a job.
Right.
Like that is art. And then all the people that were involved, I don't think a lot of us ever think about the system that is a hospital, like all the different layers of leadership and management that are involved. I want to go to the first days as you got the money and you're trying to implement this program. What did you present to them? What was the vision that you were trying to show them? And then what were those first days implementing the program looking like?
Yeah. So what I was doing in that presentation was showing them how like a phased treatment kind of approach, right? So phase 1, this is what I'm going to do in phase 1. I want to, just look at all your oral care supplies, right? Phase 2 is where I'm going to actually do a deep dive and get to know what the actual needs are. And then a phase 3 is going to be like implementing, and a phase 4 is going to do this evaluation. So it's all of that program planning that I learned in my, master's program of how do you put together a program? What do you need for a program? And then how do you follow it through? And, the first days that I was there, it was, they go through the hospital orientation. And usually when you're coming into the hospital, you come through your orientation and then you're automatically set up with a preceptor, right? So you get a 12-week preceptor. They show you the ropes of the hospital. They show you how to use the electronic health records. They show you how to use the policies, the clinical skills, the SCM, the software, all of that. And I started and they were like, here's your laptop and we're still trying to find a desk for you. You're going to be right here and we're going to put you in a desk. And I was like, oh, okay. And then they're like, okay, we're going to set you up with a couple interviews with some of the medical directors just to let you know who you are and what you're doing here. And then you're kind of like on your own. And so I was like, oh, okay. So I met with the medical directors and, a couple of the medical directors, they were like, we don't even know what you're even talking about. It's so beyond what we even know. They're like, so we're just going to trust that you know what your scope is, and then you're going to just carry it out. So it was like, okay, so really there's no support. It's just from working from the ground up. They were so welcoming of me, though, I have to say. Every single person in the hospital, it's like they were kind of confused. Everyone always gives me that look. They're like, oh, so wait, who are you? And I'm like, oh, I'm the oral health educator. And I always get that look like, so what are you going to do? Are you going to brush people's teeth? I'm like, no, I'm going to do a little bit more than just brush people's teeth. So it's, it was kind of that start of like, I have to explain myself to everybody. And I always get that look. And then once I explain it out, they're like, it's like a light bulb goes off. And they're like, oh my God, that's exactly what we've needed. That's exactly the missing link to what we've needed in this organization. So it's kind of been enlightening to see everybody change in the way that they change. And I was just the other day, I was over at AT Still Dental School over here in Arizona. And I was talking to a couple of the dentists, the directors over there. And they're like, so what exactly do you do? Like, you're doing clinical, right? And I'm like, oh, no, I don't do anything clinically. And I go in to do oral assessments on these high-risk patients. And I'm really helping to reduce oral bacteria to help decrease infection. And they're like, oh, we don't even know like anything about that. So even dentists really don't even know about that. So there's such a disconnect between the medical side, the dental side, and how we embed that in that middle person to get that person to be like, oh, this is so important. Let's take out all the clinical aspects. Let's bring it back to the preventative. Let's start at the ground from the beginning. The minute they're getting admitted to the hospital, let's try to figure out how we can keep that mouth in that symbiotic state so we can decrease infections.
That is awesome. And it is amazing, like you said, the disconnect there. And I'd like to think that you're hopefully bridging that gap. Just for our listeners, just to provide context, how long have you been in this position? And I would like you to touch on, so what does your day-to-day look like? Because I would imagine there are some listeners that are probably on the edge of their seat like me, because they just are like, this sounds awesome. Like this, there's such a need. Us as hygienists, we know there's a need there. So how long have you been doing this? What does your day-to-day look like? Go with that.
Yeah, so actually I celebrated my 5-year anniversary on April 29th. So I've been at the hospital for 5 years now. Going and, my day-to-day, it looks different every day. So it just it's like I show up to work and it's like, there's nobody to tell you, oh, okay, this is what you're doing. I go in, I look at my email, I'm looking at all my sign-outs for the day because I'm hospital-wide, right? I'm not just in one department of the hospital. I'm overseeing, the NICU, the cardiovascular intensive care, the pediatric intensive care, the hematology, oncology, the neurology, the ortho, the failure to thrives, like all inpatient rehab, like everywhere. I'm throughout the entire hospital. So I see my, sign outs for the day, and I'm briefly looking through all of them. Does any of them pertain to something that I would be needing to go into that patient's room? And then I'll go back and I'll go into the system, to the electronic health records, into what the departments are. And I have an oral health consult button. So I'll go into that, and then I'll see if there's any providers that have put in a consult for me. And if they have a consult for me, then I touch base with those nurses and say, hey, what's going on with this patient? What time can I come in to see this patient? Are they in therapy, or do we have an MRI scheduled, or are they leaving for radiation? So kind of figuring out what the schedule is like for them. On specific days, I do have a lot of hospital-acquired infection committees that I do. So I do sit on all of the infection committees that are related to possibly causing, from oral bacteria. So I'm sitting on the ventilator-associated pneumonia committee. I'm sitting on the central line-associated bloodstream infection committee. They're now having me sitting on like a PIVI committee. So I'm sitting on all these different committees, and then they want me to start heading up some of these major committees, because of what I am doing is, because I'm in the education department, I'm in a leadership role. So I'm at a level higher than what the nurses are, right? So I'm in a leadership role. So when I have these committees that are for me and I'm overseeing, I'm the one who's producing all of that education in that committee that gets dispersed throughout the entire hospital to all of the nurses. So that's kind of something that I do like once a month for each of those committees. And then I do some rounding. I do a lot of rounding with our quality control nurses, our infection prevention team, our clinical managers on the floors, our clinical educators on the floors. So we'll go through, we'll pick units for each of the days. We'll go through and do safety rounds. We'll go through and do, they call them HAC, the hospital acquired condition rounds. And it actually allows us to do real bedside education with the nurse. And it gives that nurse ability to ask me questions or ask one of the other people some question. And then I'm able to see in real time kind of what they're doing, what's their flow looking like. And then I can go back if I want to, and I can go back and audit that nurse to see, did they fill out their flow sheet correctly? Are they documenting it correctly? I can pull from our safety dashboard, see whether or not somebody hasn't been compliant in the past 24 hours. So there's ways that I can kind of pull and measure to make sure that we're all on the same page. And then sometimes, if we have a big rollout coming out, my day might look like I'm revamping our policies or our procedure guidelines to make sure that they're all lined up with the standards and the best practice. So, I mean, it's very different across the board, but you have to be a self-starter. Like there's times where I'll get into the office and I'm like, I don't even know where to begin, right? And it's like, you just have to begin somewhere, right? So, and if I have some, downtime, and then I also have, like on Tuesdays, I have dental hygiene students who come, and they're coming from Carrington and they're coming and shadowing me. And so I'm educating them as I'm going and they're just shadowing me as I go along. But I mean, it's very different. And so you have to be always on your toes. You have to be a self-starter, because if you don't, the role's not going to exist. You have to do it on your own because there's nobody else. I'll go in for a check-in with my manager sometime and I'm like, is there anything that I can work on or do better? She goes, honestly, you're great. I can't think of anything else. And I'm like, okay, do you know what I'm doing? Like, and it's, there's kind of that disconnect, but it's like, as long as you're staying busy and as long as you're making a difference and as long as the data is showing, great outcomes, there's nothing more I can do, right? So it's like one door closes and I'm like, oh my gosh, there's so many other projects. And then another door closes and I'm like, okay, I can pick up some more stuff. So it's constantly keeping myself busy.
Have you noticed with the call button that there's certain departments or certain individuals that are utilizing your services more than others?
With the consult button?
Yeah.
With the consult button. So, yeah, I would say 85% of my time I'm probably on the hematology oncology unit, just because those kids are going to be having the more, side effects related to the chemotherapy. They're going to have that mucositis. They're going to have a lot of, issues. And they're the ones who are there housed for longer in the hospital for longer extended periods of time. So they're going to be the ones who are going to have more oral issues if they arise, and where we're not able to get them into a dentist. So then we'll go in, I'll do the assessment. I'll say, we need to get this patient seen by a dentist ASAP, or, what, we could probably hold off on this patient until we can get them through this cycle of treatment until their counts recover to where we can get them seen by a dentist, because we have to do that risks and, that weighing benefits. Do we want a dentist going in there and drilling and filling when this patient is like ANC a count of 2? No, we don't. We don't want them. That's a huge infection risk, right?
So it sounds like the program has really grown quite a bit from when you started to where you are now. But it sounds like it's still only just you at Phoenix Children's, and you wear many hats, which I feel like as hygienists we just do inherently. But in your setting, you do wear a lot of hats. And so do you envision another oral health educator coming into Phoenix Children's, or do you envision this program expanding outwards to other care facilities, or what are your thoughts on that?
So I could definitely use help.
Okay.
That is a given. So I do see it expanding to having more hygienists. I really honestly feel like the critical care could have one hygienist, acute care could have one hygienist, and then, ultimately expand to having one on every single unit. But it's a lot of work. And then, one other, aspect of it is we could probably even have like a dental health coordinator, right? Who helps with kind of like with social work and helping to care coordinate, making sure those patients who don't have a dental home are leaving with a dental home when they're leaving, because I want to say 73%, I think, is our population base, is a Medicaid patient. And with those patients, I want to say maybe 2%, 3% actually have a dental home that is established that they go to. So there's so much work to getting these patients when they're coming in, because we're seeing like the sickest of the sick kids all across the state of Arizona. What an opportunity it is if we can get these patients who are already on Medicaid set up with their dental home so they can get their access to care a lot easier, because nobody knows where's the closest one to my house. Do they accept my language? Do they accept the insurance? Are they close proximity in case you have, no transportation? All of those come into consideration. And that takes up a huge chunk of my time to find one patient a dental home and trying to make sure, does somebody out in the community, does a dentist out in the community, do they feel comfortable taking a medically complex patient? This Down syndrome patient who might have had some heart issues and post-bone marrow transplant, there is very, very few dentists that are willing to even touch that patient. So I have to figure out which dentist is going to be able to take on that patient. And so do they have privileges at the hospital in case they need OR anesthesia, cardiac anesthesia? Those are all things that I have to consider when I'm referring out, which also could be trained by a dental health coordinator, which could be a dental hygienist, to do all those referral processes. So very, very much ability to expand, I see, in the hospital. We just need to figure out a way to get that funding, to get us funded, because the hospital's like, yeah, we see what you're doing, and maybe I'm doing such a good job that they're saying, oh, you don't need any help or support. But in reality, it's like, it's almost to the point where it's like, I'm not able to do all of these other things because I can't support in this area. So
yeah. So let me ask this: so you put out a message on Trapped in the Op, and it was a beautifully written message. How can we help? Like, what are you hoping that the listeners are going to get from your experiences?
Yeah, so I really hope that it kind of empowers hygienists to really start to critically think, expand themselves, get out there, start networking, start building up your resume. I know when we're feeling trapped, where our resume shows, oh, I've been at this dental practice doing clinical hygiene. And when you're trying to get out of clinical hygiene, you're not a good fit anywhere, right? Everywhere else is like, oh, we don't really need a clinical hygienist. But I, worked so hard on my resume, and even my resume, they said, wasn't even the greatest, right? But I worked so hard and doing so much work for free, went out to public health departments, said, hey, how can I help support you? What do you have an oral health division? Do you have any areas for like special needs patients that you need me to educate caregivers? Start doing that work on your own time for free. Add that to your resume. That is going to put you at the best benefit of getting a job outside of the clinical operatory. And one thing that I'm starting to do is I'm starting to realize I'm getting reached out to by so many of these hygienists, and they're like, we want to do what you're doing. And it's getting them trained. We don't have a degree, right? We don't have right now anything that's going to help support. We're going to start working on hopefully getting some certification programs to getting to where they need to be so they can bypass that year or two that it took for me getting into the hospital setting. But I really want them to feel empowered and be able to feel confident that they know what they're talking about. So when they do approach these hospitals, they're like, I feel like I know what I'm talking about, and here's what I can bring to the table, and here's why you need me. And if we can get them to feel empowered in that manner, we're going to see these jobs just start to come for these hygienists. When hygienists don't know, what a hospital-acquired infection is, and they can't speak to, well, if you do this type of oral care, you're going to decrease it by this amount, and we're going to see a decrease in central line infection. If you don't have that knowledge and you don't have that language, hospitals are just going to overlook you, right? So I started this, MDI, this medical dental integration hygiene consulting, and I put that out there for those who are wanting to know a little bit more, really kind of getting comfortable with the language, kind of getting a little bit more comfortable with how to work with medically complex patients in a hospital, and starting to do like maybe a retreat style. I haven't even designed it yet, but I'm really just trying to put out the need. Is there a need? Is there a want? Is there a desire from hygienists to want to do something like that? And kind of bring them together, work in more of a smaller capacity, because I don't have that time to expand to, each individual hygienist helping to work along the way. I have to do it more in a smaller group setting so I can help to get them there. And then ultimately, hopefully I can be that voice for them when we approach hospitals and say, hey, I have this hygienist here who has gone through, all of this learning with me, and I'm going to be, their liaison. I'm going to be their preceptor for them when they get hired for you guys, so they can ask me the question and we can kind of embed them and implement them, and they can do exactly what I'm doing in half the time that I did it. So that's what my goal is, and hopefully we can get hygienists to that level to expand it.
You are an absolute amazing person. I can't believe you're doing this.
Absolutely.
You've taken something and created a whole new space for our profession. I just thank you so much for that. If someone wanted to reach out to you, if they wanted to maybe ask you a couple of gentle preliminary questions, because she doesn't have all the time in the world, so just easy questions. But if they want to reach out to you, what's the easiest way for them to get a hold of you?
So there's www.mdihygieneconsulting.com is a website, and that's directly to my website. You can go there, you can subscribe, and then I automatically have your email so I can send out some newsletters or any information that I come up with, or you can directly email me at www.mdihygieneconsulting@gmail.com.
Awesome. Thank you so much for being on.
Thanks so much, Katharine. You're a visionary.
Yeah. Oh, thank you guys. Hopefully we can start to see these hygienists start to expand themselves. That's what I would love to see in all these hospitals, having a hygienist.
Yeah, absolutely.
Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of two hygienists.